And in March, the US announced the end of the program review by the United States Agency for International Development. 83% of aid has been cut, and many African countries will be impacted. France 24's Fraser Jackson caught up with US State Department's deputy spokesperson, Mignon Houston, and asked her about USAID pulling out of Africa and elsewhere.
We have been very clear in telling people that we're not cutting foreign aid. We're just realigning it towards this administration's values, the values that were voted in by the American people. That means, as it relates to foreign aid, emergency assistance, food assistance, humanitarian assistance is still being approved. And that includes water, it includes food, it includes shelter, it includes those dire resources that are necessary in conflict zones. So I think just to focus on the fact that we are not done in the foreign aid business, as the Secretary has said, we are essentially just realigning much of that money to ensure that it's being spent in the right way.
So let's bring in now our guest tonight, Dr. Alain Maina. He's the Chief of Public Health at UNHCR. Dr. Maina, welcome. So the UN Refugee Agency basically is in charge of essentially delivering healthcare for nearly 13 million refugees. So what's the impact of that slashing?
Thank you, Clarice. And as you rightly noted, with the current financial situation, we fear that close to 13 million refugees, including over 6 million children, run the risk of not being able to access life-saving health and nutrition interventions. Over 50% of these 13 million refugees are in Africa. Africa is a continent that is hosting millions of refugees, and governments have been very generous, but they also facing a lot of challenges, including a decline in health expenditure. What we're fearing is that essential services will be disrupted, running an increasing risk of disease outbreaks, children suffering malnutrition, untreated health conditions, mothers delivering in unsafe conditions, thus increasing the risks of maternal and newborn deaths. We also fear that we'll be seeing more mental health issues. Facilities are being overwhelmed significantly by the current funding situation. And basically what we are saying is that the health consequences we fear are expected to be devastating.
So the announcement was issued in March, and I know you've been in the field. So have you already witnessed the consequences of these cuts?
Yes, Clarice. Unfortunately, the impact is severe and immediate. I'll give 3 examples. In the Democratic Republic of the Congo, where UNHCR's health services has been cut by close to 90%. We're seeing that some facilities that are overwhelmed with limited staffing, they're running out of medicines and supplies, the water systems are disrupted, and increasing the risk of infectious disease outbreaks, putting the lives of more than 500,000 refugees in the country at risk of even death itself. We also have Mozambique, where we are working closely with the government in a settlement called Maratane, serving both refugees and host communities. This facility saw over 80,000 visits last year. The funding has been cut by more than 50%, and the UNHCR and its partners are trying their best, but critical services are affected, including mental health and psychosocial support, HIV and TB testing and treatment, and even access to safe maternal care. And lastly, also a very daunting example in Ethiopia, where we are seeing that our partners, we are having to shut down certain nutrition facilities, and we've seen children being discharged abruptly or prematurely. And we all know that this runs the risk of more life-threatening consequences for over 80,000 children who are affected in that location.
So, Dr. Maina, what's next? Does your organization have a plan to face challenges ahead?
Yes, we do have a plan. UNHCR has been there for decades. We continue standing with refugees, and we're working together with governments and partners closely to mitigate or limit the impact of this funding situation. We're doing our best to work as efficiently as possible, but it is difficult. We're having to make very difficult decisions. And I would just like to noting that we don't have enough time, that it is a time of crisis. And this is a crisis on top of a long-standing situation of low funding for humanitarian situations. And what we're calling for is that we stand for humanity and be able to see individuals, governments, donors, private sector, not forgetting refugees and the people who are generously hosting them. We need to save lives, not lose lives.
Dr. Mena, we hope that your messages will be heard. Thank you very much. Dr. Alan Mena is the Chief of Public Health at UNHCR. Thank you very much. And meanwhile,